Welcome to USA Global TV and Radio, where our mission is to provide education, entertainment, hope, and inspiration. USA Global TV and Radio connects you with experts and audiences all around the world every single day to help you succeed in business and to live a richer life. Visit us at usaglobaltv.com to learn about career and life-changing training and mentoring programs like the Listening Mentor. Subscribe to our newsletter to stay informed about our special programs and offers. Discover how you can become a guest on one of our shows or a host or producer of a USA Global TV and Radio show of your very own. That's USA Global TV and Radio, where the doctor is always in.
Hello and welcome to USA Global TV and Radio. I am Tracy Cram Perkins and our show today is Dementia Home Care. I invite you to subscribe to our YouTube channel, USA Global TV and Radio. I am a 4-time dementia caregiving survivor and the author of Dementia Home Care, How to Prepare Before, During, and After. Joining me today is Dr. Les Griffith. Dr. Griffith is a physician, author, lecturer, and public speaker who has been involved in educating medical students and the public for over 40 years. He is a the Harvard of Science-Based Natural Medicine, where he holds a position of Professor Emeritus. He has spent the last 10 years researching the role that mitochondria play in the generation of inflammation that activates macrophages and microglia in aging and degenerative disorders, and how an age-related deficiency of alpha-ketoglutarate, also known as AKG, can cripple the stem cell's ability to heal and repair or replace injured, old, and dysfunction cells. He is currently researching how CBDs and anti-inflammatory and antioxidant mechanisms play a role in the prevention of disease. Welcome, Dr. Griffith.
Well, thank you, Tracy. A pleasure to be here.
Would you please tell our audience a little bit more about yourself?
Sure. I've been a practicing physician for 40 plus years. Started my practice in OB-GYN, where I delivered some 3,000 or so babies, moved on into hormones, and that got me into research about chemistry and biochemistry. And the last 10 years or more, I have been doing a lot of work with the endocannabinoid system, how CBD relates to the endocannabinoid system, how that all relates to inflammation and oxidative stress, and how all that relates to disease, particularly degenerative diseases, particularly neurodegenerative diseases.
Fantastic. So, okay, you talked a little bit about degenerative diseases. And let's talk about cannabinoids and their uses in treating dementia. Can you talk a little bit about that?
Sure. So you want to sort of start at the beginning. If you look at a disease like Alzheimer's, it develops certain symptoms that we associate the disease with: memory loss, cognitive disability, and so forth. But the symptoms of the disease don't resemble in any fashion what actually caused the disease. And that's sort of where I like to focus. CBD is a very powerful anti-inflammatory and antioxidant. Since Alzheimer's and dementia is an inflammatory oxidative kind of disease, CBD can become a tool for helping reduce or eliminate the oxidative stress that drives that process. You really, you want to look at the base, what really triggers the Alzheimer's or Parkinson's disease itself. And you have to start at the very basics. You have to really start with how the body produces the energy that runs the system. Life doesn't exist without energy. And in the first law of thermodynamics says that you can't either create energy or destroy it. So life has to come up with energy from somewhere. If you're a plant, that somewhere is the sun. But if you're not a plant, that somewhere is the food that we eat. And that somewhere in our system is the mitochondria, which ultimately breaks those processed food particles into energy. Uses AKG and other substances, but AKG is one of the principal substances the mitochondria uses. Combined with oxygen, and energy is liberated. But it's a very messy kind of process where a lot of oxidizing chemicals, superoxides, peroxides, and so forth are made. And those chemicals are incredibly damaging to living tissue. AKG is one of the principal processors in the production of energy in the mitochondria. And it is also a very powerful antioxidant. Part of this production of energy, I said, produces these very cellular toxic oxygen-based chemicals, oxidizers. So part of AKG's role is controlling the oxidation produced within the mitochondria, as well as participating in the production of energy. These oxidizers happen in every cell. We have somewhere in the neighborhood of 35 trillion cells in our body, and every one of those cells has a mitochondria, at least one. Some have multiples. And these are all producing these oxidizing chemistries. If that mitochondria is in the brain, in a brain cell, and that brain cell is in an area that you think with, you cogitate with, or your memory is involved with, the damage that those oxidizing chemistries causes impairs your ability to think or remember, essentially Alzheimer's. If that damage is in an area that produces the chemicals to allow you to move, then you wind up with something like Parkinson's.
So, what can an ordinary person, oh, bear with me just a second. What can an ordinary person do to promote taking care of this so that they don't have the oxidizing taking place?
Well, you can do several things. It's sort of the way we treat Alzheimer's and degenerative diseases now is focus directly on the disease. Alzheimer's has abnormal amyloid proteins, abnormal tau proteins. So the current work is focused on eliminating those amyloids or tau proteins. But the body made amyloids and tau proteins to do a job within the nerve. So if you invent a drug that simply does away with amyloids, you may, in fact, help somebody who has Alzheimer's, but you may create significant other problems because you've eliminated a very important protein that the nerve cell makes. You can alter those things in several ways. Ordinary anti-inflammatories attack the inflammation problem relatively mildly. CBD is a pretty potent anti-inflammatory and antioxidant that appears to help people who have Parkinson's or Alzheimer's by eliminating the causes of the cellular destruction. But in Alzheimer's, as in Parkinson's, the damage has already been done. So if you are not focusing on a therapy that helps overcome the damage, you are simply lessening the impact of symptoms. Eliminating symptoms can be a good thing, though it can help people live longer, more productive, and healthier lives, but it doesn't get to the cause of Parkinson's or Alzheimer's or other degenerative diseases. I also work with stem cells and stem cell exosomes. Stem cell exosomes are the actual working chemistries within the stem cell that get the job that stem cells do done. Stem cells actually can repair and begin the healing process of diseases like Alzheimer's and Parkinson's. And when it cannot repair them, it can rebuild new cells, new nerve cells. So it's the next step in treatment that replaces old, worn out, dysfunctional cells with new cells. But until you focus on what caused the old worn out cells to become old and worn out, you're eventually going to run into the same problem. The problem occurs because of these oxidizing chemicals, superoxides, peroxides, and so forth, that are produced in mitochondria and spread to other cells, tissues, and body parts. The mitochondria are the initiator, and this mayhem of oxidative damage is what produces the symptom picture that we call Alzheimer's or Parkinson's or other neurodegenerative diseases. But the ultimate culprit is our ability to make AKG, alpha-ketoglutarate, is an important antioxidant. It's important in the mitochondrial energy production mechanisms, but it's age dependent, meaning that approximately age 30, our ability to make AKG begins to weaken and AKG levels begin to decline. So AKG, remember, not only regulates energy production, but its role is reducing oxidation that causes all the damage in cells. But AKG is also involved in increasing health span. Health span is the amount of time we live in our lives without disease. In Alzheimer's, we all know the end-stage symptoms of Alzheimer's is a definite decrease in health span. AKG is also involved in building muscle, collagen in the skin and bone, promotes bone growth, inhibits osteoporosis. It's one of the primary cellular signaling chemicals, and it's involved in stem cell function. We all have stem cells. Their whole role is healing and repairing us when cells become injured or when they become so old and dysfunctional as to be problematic. Stem cells replace those old, worn out cells. But AKG, which is the primary energy driver, if that mitochondria is in a stem cell that is experiencing AKG deficiency, the energy that is required to run the stem cell declines. The stem cell cannot function as well as it did when we were 20. So according to the British journal Nature, of the 37 to 35 trillion cells in our body, when we are 20, 200,000 of those are adult stem cells. When we're 20, that number declines to less than 40,000 by the time we reach 80. And their functional ability to heal, repair, and or replace declines by as much as 90%. We have the most stem cells we will ever have when we're 20. And once we use them up, they're gone. It's essentially game over. A 20-year-old can heal and repair 10 times more efficiently than an 80-year-old. It appears at first glance that our lifespan is simply the amount of time it takes for us to burn through our supply of AKG. So what can we do as individuals to overcome this? Well, we can do CBD as an anti-inflammatory and antioxidant. We can also do stem cell and stem cell exosome implants. We can replace our old worn out stem cells with brand new ones that can actually heal, repair, and replace. And we can supplement AKG. AKG isn't found in food, so you can't just find something like broccoli or Brussels sprouts and take that to replenish AKG. You have to take it as a supplement. Your own ability, your own enzymatic ability to construct AKG weakens at about age 30 and degenerates at approximately 2% per year from then on.
Well, Doctor, let me ask you a question then. When you are talking about the stem cell replacement, what is the source of those stem cells?
So in your body, almost every tissue makes stem cells, progenitor cell, they're tissue specific cells. And your own stem cells degenerate. We get stem cells for replacement therapy from umbilical cords from newborn babies. No baby's life was threatened. The cords are volunteered, and the tech companies extract the mesenchymal stem cells from Wharton's jelly within the umbilical cord, and then they further extract the exosomes from the stem cells. Because sometimes you want stem cell therapy, and sometimes you don't want the cells cluttering up the process. You just want the exosomes, the actual chemicals that do the healing and repair work. But they come from umbilical cords.
Okay. So, that leads me to another question. If you're choosing to do a stem cell treatment, at what point would you choose to do that? I mean, is it you would, when you first find out that you might be having memory loss or first signs of Parkinson's or something like that? Or what would lead someone to choose to doing stem cells?
Yes and yes. The answer is the sooner the better.
Okay.
So I said, that your AKG levels, which are involved in the beginning of this whole process, begin to decline at age 30. But at age 30, most people don't have Alzheimer's or Parkinson. Although at age 30, they could have the oxidative damage beginning that will ultimately show up as Parkinson's or Alzheimer's. So somebody at age 30 should probably be thinking about supplementing their AKG levels. If you already have Alzheimer's, have been diagnosed with Alzheimer's, you certainly also want to be on AKG or CBD to counter the effects of oxidizing chemistries. Stem cells will help your body regenerate, repair the damage that those oxidizers did. But the cause of those stem cell deficiencies were an AKG deficiency. So you can get brand new stem cells and they will do wonders for however many years they last, 3 to 5 years or so. And then they're going to degenerate just like your own native stem cells did, unless you were supplementing AKG, which helped stem that tide.
Okay. Now I have 2 more questions, but I'll give you the first one first. People listening are going to, you talked about CBD. Is that, you were saying it was part of supplementing the AKG? Is that correct? Promoting it and boosting it? Am I
Yes,
understanding correctly? Okay.
right. In my practice, in my clinic, we recommend that stem cells be done in conjunction with CBD. We do CBD IV. We do stem cell and exosomes IV also.
Okay, so now to my next question. If a 30-year-old is watching this right now and is thinking, oh great, I can run down to the drugstore and buy CBD, is that going to do the same thing as what you are discussing in the therapeutic setting?
For the most part, the answer is yes. However, CBD is oil-based or lipid-based. It's a lipid substance in the plant. And 2 things: when you go down to the store and buy CBD, you don't always know how much CBD is actually in the product, no matter what the label says. And the second thing is your ability to absorb that oil ranges from a low of about 10% to a high of about 20, maybe 30%. So at the most, you're only getting about a third of the CBD that you see on the label when you swallow it. When we do IV, it's 100%. Now, there are also water-soluble nanotech CBDs that absorb almost 100%. One of the problems with oral medications, anything you take by mouth from the stomach, it makes a first pass through the liver, which removes a lot of the CBD. So you only absorb 30%, and then it goes through a first pass So somewhere less than 30% is the actual amount you get to wherever you want it to go. IV CBD is 100% right there, right now.
Okay, then what happens to the liver when you start building up CBD in the liver? Does it have any damage?
No,
Okay.
CBD doesn't build up in the liver. In fact, we have not found a toxic amount. By that I mean there's no LD50, no lethal dose of CBD, and no negative side effects of CBD. So you can't overdose CBD that we know of.
Wow. That's good to know.
So, interesting thing. I said this whole oxidizing process is involved in the process of degenerative disease. But you can also look at this oxidative process literally in the manifestation of almost every disease, cancer, and so forth. There's a lot of research going on right now with how to deal with cancer, with the actual triggers of cancer. We're not absolutely convinced that this deficiency of AKG doesn't have something to do with that area also.
Interesting. All right. Well, then.
Blew your socks off. Huh?
I wasn't expecting that, honestly. Not at all. So going back to somebody that now is like, say, in the early stages of Alzheimer's disease or Parkinson's, if they do not have access that help them. So if they do not have access to the medical community to help them with a CBD treatment or stem cells, what can they do, or can they?
Well, you don't assume I'm against standard chemotherapy and so forth treatments for cancer or standard treatments for Alzheimer's or Parkinson's. Those treatments are more symptomatic. They're designed not as curative agents, although we see cure occasionally, but as palliative, symptom reducing kinds of things that help you get on with your life or live out the rest of your life as best you can. AKG is recommended more as a preventive. That is, if you start taking AKG before the body struggles to be able to build AKG molecules, then you essentially would never become AKG deficient. Your mitochondria would produce energy. They would still have the fission and fusion that creates reactive oxygen, but AKG is an antioxidant that can deal with that. So as a preventive, and I tell people that CBD is is that kind of a chemical also. It is best used as a preventive than it is used as a curative agent. CBD appears to be able to do things with cancer and with Alzheimer's and so forth. That's pretty miraculous. But its ability to prevent the disorders in the first place is where it makes its mettle.
Okay, let me ask you another question then. We're getting close to the end of the program here, and I would just like to know, is this something that in the US insurance covers, or is this something that's something what someone would have to pay out of pocket for treatment like this?
You'd have to pay out of pocket. Insurance doesn't particularly cover in the US. Now, in Europe and in other countries, stem cell therapy and AKG therapy and so forth are more available. I know nothing about how their insurance companies pay for it. I know that in the US, these are out of pocket expenses.
Okay. Is there anything else that we should know about this? About the treatments, the CBD?
Um, no, I think we've covered it. I caution people that we're still doing a lot of research in this area, and I've said things that I believe to be the truth that are backed up by the research that's available to date. But I'm a physician and a scientist, and I know that tomorrow's data could throw everything we know today to be the truth out the window. But for today, this is the best data we have.
Fantastic. Well, Dr. Griffith, I really appreciate you taking the time out of your day to come and join us. Um, right now, we're showing your website. So if anyone wants to take a look or get in contact with Dr. Griffith, you can go to his website for dynamic regenerative care. You'll see at the bottom of the screen, his website is located there. Do you have any other thing you would like to say before we end the show today?
No, I'm quite happy to be here. Thank you.
Well, again, thank you for coming on and joining us. And also, thank you to our audience. We will be back on December 19th, and our guest will be Beth Marie Fahey. Beth Marie is a dementia caregiving survivor and blogger, and she will share with us the importance of life after death of a loved one with dementia. So we'll see you next time, everyone. Thank you.